Hello, hello, everyone. Thank you so much for joining our call today. We are going to give it just a couple minutes for folks to join on, and then we'll go ahead and get started. Thanks again. Hello, everyone. I see folks are logging right on and our numbers are going up. So we are going to give it just a minute for folks to log on and get settled, and then we'll go ahead and get started. Thank you so much for joining today. Hello, hello, everyone. Thank you so much for joining today. Delighted to be here with you all. We are going to give it just one more minute for folks to log on, and then we'll jump right in and get started. All right, it looks like we are slowing down with folks logging in, so let's jump right in and get started. Hello, hello, everyone, and welcome to NLIHC's National HoUSed campaign call for universal, stable, and affordable housing. I'm Kim Johnson, Policy Manager at the National Low Income Housing Coalition, and it is my honor to be moderating our call today, the first national call of 2023, so welcome. Today, we are going to kick the call off with an update on the 118th Congress, prospects for enacting legislation, and potential threats to existing federal investments in affordable housing programs and homelessness resources. Then we'll turn it over to Drs. Maria Raven and Mark Fleming, two researchers who will be sharing findings from the recent report on the impact of stay-in-place hotels on healthcare system utilization among people experiencing homelessness during the COVID-19 pandemic. We'll hear field updates from Amy Riegel, Executive Director of the Coalition on Housing and Homelessness, Homelessness and Housing in Ohio, and Jenny Jones, Communications Director at the Minnesota Housing Partnership. Lastly, but certainly not least, NLIHC's very own Sid Betancourt, Housing Advocacy Organizer Extraordinaire, will give a preview of NLIHC's Tenant Talk Live series for 2023. We'll, of course, also be answering your questions throughout. So without further ado, let's jump in and get started. Next slide, please, Nate. Perfect. So let's start with a quick recap of some of the successes in the previous Congress, just to, start the year off on a good foot. So in the 117th Congress, we had some very meaningful victories. We secured billions of dollars for emergency rental assistance, an historic moratorium on evictions at the height of the COVID-19 pandemic, billions of dollars for new housing vouchers in the American Rescue Plan Act, and funding for resources to assist people experiencing homelessness and connect them to non-congregate emergency shelters and permanent supportive housing. Billions of dollars in state and local fiscal recovery funds have also gone towards the construction and preservation of affordable housing. And most recently, we secured a $1.8 billion increase to HUD's budget in the FY23 appropriations package. And of course, none of this would have been possible without the tireless work of advocates across the country, including many of the folks on this call. So thank you to everybody tuning in for all of your work. And still, even with this influx of resources, the country is experiencing an affordable housing and homelessness crisis. People are struggling to make ends meet, and more resources are desperately needed to ensure that everyone has a safe, quality, affordable, and accessible place to call home. Next slide, please. Unfortunately, this Congress, the 118th, is shaping up to be more challenging for advocacy. We are now in a divided Congress with Democrats maintaining control of the Senate and Republicans taking control of the House. So any bill that passes both chambers will need bipartisan support. Processes like reconciliation, which allows the legislation to pass the Senate with a simple majority of 50 votes rather than the 60 votes typically required in the chamber, will be off the table. I'm sure many folks on this call followed House Speaker Kevin McCarthy's contentious election 2 weeks ago, which took a process that is supposed to be routine and stretched it into a 4-day, 15-vote ordeal that required Speaker McCarthy to make some concessions to a far-right facet of his party in order to secure his leadership position. Next slide, please. So the House adopted a rules package last Monday that reflects many of these changes, including reinstating a rule that allows a single member of the House to force a vote to oust the Speaker. And that is not particularly relevant to our work, except for it is to say it allows a lot of room for some congressional shenanigans that will gum up the legislative process. The rules package also contains provisions that will make our mission of increasing federal investments in affordable, accessible housing and homelessness resources considerably more difficult. So, for example, the previous Congress operated under a rule known as PAYGO, which states legislation that adds to the federal deficit must be offset with either cuts to spending or tax increases to increase federal revenues. The new Congress has replaced this rule with one known as CUTGO, which only requires offsets of legislation if legislation will increase mandatory spending, meaning that the House can pass legislation that would enact tax cuts that would add to the federal deficit without any offsets. Additionally, the House will need a supermajority, which is 3/5 of the chamber, to vote in favor in order to enact tax increases. These are standards that prioritize the desires of corporations and higher income individuals while slashing funding for programs that would help address the dire needs of people with the lowest incomes. This rules package also scraps a previous rule that allows the House to automatically send a measure to extend the debt limit to the Senate when the Senate adopts a budget resolution, which sets up a fight later this year when Congress will need to extend the debt limit. And I believe my colleague Elena is going to drop a link in the chat that provides a really nice overview of kind of the history of that debt ceiling fight and prospects for what that fight is going to look like during this Congress. The rules package also reinstates a rule allowing members to offer amendments to appropriations bills that target the salaries of specific employees or target funding for specific federal programs, allowing members to propose amendments that would decrease funding to as little as $1, which would effectively defund those programs or offices. And even next slide, please. And even outside of that rules package, Speaker McCarthy has made several commitments to slash funding for domestic spending programs that bode poorly for FY24 appropriations negotiations and negotiations to raise the debt ceiling. One such commitment includes a promise to reduce FY24 discretionary spending to FY22 enacted levels, which would result in a cut of $130 billion to non-defense discretionary spending, including an about $8.1 billion cut to HUD programs and, of course, potentially greater funding cuts. The Speaker is already threatening to reject any FY24 negotiations with the Senate that do not fall in line with the House proposal, and threatening to refuse to increase the debt limit without fiscal reforms, quote unquote fiscal reforms, that would slash discretionary spending. House Republicans have also committed to investigations into the use of COVID relief funds, including American Rescue Plan Act funding and specifically state and local fiscal recovery fund dollars. We also cannot take for granted that Democrats in the House and Senate will stand united against potentially harmful proposals to slash funding or impose harmful barriers to increase housing assistance, like work requirements, time limits, or blocking access to resources for immigrant households. We are also looking at, another election next year in 2024, during which 20 Democratic senators will be up for re-election. And so they're going to be forced to make some pretty hard votes in order to secure their re-election. Next slide, please. So all of that is to say, we have our work cut out for us in this Congress. In particular, we will need to focus on pressuring Republicans and Democrats to work together to prevent catastrophic outcomes like a long-term government shutdown or the federal government defaulting on its debt, or cuts to vital programs that help ensure that people with the lowest incomes have a safe place to call home, have funding to put food on the table, are able to afford their home heating and electric bills, all of those vital things that we know people are using these resources for. This is likely not going to be a Congress where we see any big game-changing legislation enacted, but there will be opportunities to, say, move smaller scale bipartisan proposals. NLIHC has 2 bipartisan proposals in the Senate, both the Eviction Crisis Act and the Family Stability and Opportunity Voucher Act. Have bipartisan support in the Senate, and we are, of course, going to be plugging away to get those enacted this year. The next couple years, though, are really going to be about fighting off budget cuts and planting seeds with members to shore up support for our proposals in the future. We need to be engaged with members of Congress to fight back against harmful proposals with facts, figures, data, and storytelling to underline the impact of affordable housing and homelessness programs and the necessity of keeping stable and increasing that funding for those programs. Next slide, please, Meg. And that is just a little doodad, I can't remember what they're called, to take you to our Take Action page where you can find ways to get involved. And I'll pause here to take a look at the Q&A and answer some questions before we move along with the agenda. Oh dear. I see that my audio has been going in and out this whole time. Love that. QR code. Thank you, Erica. So I'm so sorry. I just looked at the chat and am now seeing that my audio was in and out. Now I'm hearing it wasn't too bad and you're hearing most of it, so that's good news. But anyway, are there any questions folks have? Feel free to submit them into the Q&A. Otherwise, we will keep the agenda moving right along. All right, cool. Not seeing any questions. I'll just take a second to encourage folks to look at our Take Action page, use that QR code to see the resources that we have available. We are gearing up now for what is certain to be a fight to maintain and increase federal investments in affordable housing. And of course, we are not going to be backing away from any of that. So look forward to more resources in the future. Oh, I see a question from Sherry Ebal in the Q&A. If not cutting budgets, where do you propose the money come from for these initiatives? Increase taxes on wealthy people, increase taxes for extremely well-off people so that we actually have the funding to pay for all of the resources that help people. We need a more fair and equitable tax system. We also need to make decisions around how we spend money. Budget is a moral document, and it tells you where we are putting our investments, where we are putting our resources, and the fact that affordable housing has been so short-shrifted and so underfunding for so long means that we have a lot of work to do to catch up and to make up for those years and years of disinvestment. So we need to make better funding decisions, and we need to enact a more equitable tax system that makes sure everyone is paying their fair share. Another question: with this unfavorable scenario in the House, do you think there will be a shift towards state and local level advocacy? That is a great question. I think that there is always, of course, room for state and local advocacy, and that work needs to be continuing. And it is also going to be up to federal advocates and our members of Congress to make sure that people are getting the federal resources that they need. It is a responsibility of the federal government to make sure that that people have the resources they need to survive. And so we need to be doing both. But that is a great question, and state and local advocates play a vital role in making sure that people in their communities are safe, and they're also, of course, experts in what their communities need. So keeping up that partnership too between federal programs like NLIHC and state and local advocates so that we know what's going on the ground, and what people need, what resources people need in their communities is also vital. All right, cool. So with that, and of course, please feel free to reach out to me with any additional questions. But with that, we are going to move it right along, and I'm going to hand it over to Dr. Maria Raven from the University of California, San Francisco, and Dr. Mark Fleming from the University of California, Berkeley, to talk about findings from a recent report on the impact of shelter-in-place hotels on healthcare system utilization among people experiencing homelessness during the pandemic. Take it away. Thanks so much for joining.
Sure. Thanks for having us. This paper and kind of analysis study was a really nice joint effort between a lot of different organizations. So I wanted to list some of them here. I'm a faculty member at the UCSF Benioff Homelessness and Housing Initiative. And I think I have a slide about it coming up, but it's a pretty great initiative that's headed up by Margot Kuchel as its executive director. And basically it provides support for people like me, researchers and others, to do different kinds of research and policy work to inform how we can better address the housing crisis in California. The UCSF Department of Emergency Medicine, that is where I come from as well. I'm a full-time faculty member there, and so I'm an emergency physician, and that's a lot of why I'm interested in a lot of these different issues that we're researching and kind of how people use the urgent and emergent healthcare system. Mark is from UC Berkeley, and Mark, I'll let you tell a little bit about yourself, and then we'll quickly move on.
Sure. Hello, everyone. I'm a faculty member at UC Berkeley School of Public Health. Happy to collaborate on this project with Dr. Maria Raven. Thank you very much.
And then I wanted to shout out the San Francisco Department of Public Health, because a lot of the research that our group at BHHI does involves an integrated data set that they are kind enough to give us access to. So thanks to them as well. So we can move on. So we had a paper published, and that's what this is about, called Association of Shelter-in-Place Hotels with Health Services Use Among People Experiencing Homelessness During the COVID-19 Pandemic. That's a little graphic of the paper. It's been actually widely looked at, which is really cool. I think a lot of people were sort of interested in this idea of what is the impact of shelter-in-place hotels, because a lot of different jurisdictions use them in order to kind of help people that were really vulnerable during the COVID pandemic, at least in the initial phases. And this is just a little shout out to UCSF BHHI, and you can go to the website and learn a bunch more about them too. We can move on. So just a little bit of background, like why did we do this study? Why were we interested in this? So people experiencing homelessness have disproportionately high emergency department use, and this held true during the COVID-19 pandemic. And then also people experiencing homelessness are also at increased risk of COVID-19 infection, as well as related morbidity and mortality. And you all, I'm probably to some degree preaching to the choir here, but there are lots of different reasons for that. In California, there were a lot of different outbreaks in shelters. People weren't necessarily prepared for kind of the close living quarters that people were in. And then, of course, people that are experiencing homelessness often have high morbidity and mortality anyway. And so they have health risk factors that put them at risk for doing more poorly if they were to get infected with COVID. And so that was sort of the impetus for these shelter-in-place hotels, which we can go to the next slide. So shelter-in-place, as they're known, SIP hotel program. So in April of 2020, San Francisco implemented this emergency shelter-in-place hotel program, and it was meant to provide non-congregate shelter to people experiencing homelessness that were considered vulnerable to severe COVID-19, either due to age and or different comorbidities that they had. There were 25 of them in San Francisco. They served a variety of different numbers of people. They all have private rooms, bathrooms, and 3 meals a day, which is really, really different from a lot of the other types of shelter that are normally offered in the city. They also had on-site medical clinics and referrals. So each SIP hotel offered a minimum of 1 half-day nursing clinic and 1 half-day medical clinic per week, and at maximum offered 40 hours per week of medical staffing at hotels. And that was geared towards guests that had higher medical needs. And these offered basic evaluations, treatment of minor conditions like basic wound care. They would do buprenorphine inductions and referrals and transportation to offsite clinics for like wider scope primary and specialty care that they may not be able to provide there. And then CBOs offered some additional services, and that differed from site to site. And we can go to the next slide. So our objective was to evaluate the impact of these hotel placements on health services use among a subset of people that before they were placed in the SIP hotels had high acute service use. We can go to the next slide. So before, when I was speaking about the San Francisco Department of Public Health, they have an integrated database called the Coordinated Care Management System, or CCMS. And it links information at the person level for multiple different county agencies. And so it includes medical, behavioral health, and social service delivery data, and data on social needs, including homelessness and shelter use. And it creates a record for anyone who self-reports as homeless in a healthcare encounter, or anyone who uses homeless services like shelter or housing navigation centers, or uses county behavioral health or emergent or urgent health services, or anyone who's booked in the county jail. So basically, if you have an encounter with any of those places, you will have a record in CCMS. And that's kind of what gets you into the data set to begin with. So for our analysis, we used a retrospective match control design that compared health services use between people that were experiencing homelessness with prior high service use who did and did not receive a SIP hotel placement. And it's really important to have a control group in studies like these, because if you're looking at people that have high use of health services, for example, or do anything frequently, basically, if you just allow some time to pass, there's a phenomenon called regression to the mean where that use will drop off, even if you do nothing. And so if you do like a pre-post analysis and you say, I'm going to do this great intervention, and I have all these people that were using the ED a bunch of times, and then we did this thing, and then we looked at them 6 months later and look at how much their emergency department use dropped. Without having a control group, it's hard to know how much was due to your intervention and how much was actually due to regression to the mean. Like their use just dropped off, because that's what things up here do. They tend to statistically go down. And we extracted all records of individuals in the database with emergency service use between July 2019 and March 31st, 2020. That was about 45,000 people. And then we kept those that had this HoUSed score, which is high users of multiple systems score. And it kind of calculates a numerical score in the data set based on all the different services you use. So it kind of adds each service use up and creates a score. So we took the top 10% of those folks who also had at least 3 ED visits in 9 months, because we wanted to capture people that had this high use of services so that we could actually evaluate if service use dropped. And then we isolated the subset of those high users who were placed in SIP hotels between April 2020 and April 2021. That was 440 people. Then we excluded those who were in SIP hotels for only short stays of less than 90 days, because we wanted to be able to kind of look at folks who had been in the SIP hotels for at least 3 months in order to give the hotels as an intervention sort of a chance to have that impact of potentially reducing health services use. And then we excluded people who died during the study period. And that left us 2,799. This is for the control group. I apologize. And so then we identified 343 controls, and we matched the controls to the people that were placed in the SIP hotels based on all these demographic characteristics, homelessness status, and then also we looked at their pre-study medical and behavioral health use to make sure they were matched there as well. And we looked at service use 90 days before and 90 days after SIP placements that occurred in that year, April 2020 to April 2021. You can go to the next slide, which we can probably kind of cruise through here, but this kind of just shows how we selected people who we excluded and how we eventually ended up with this eligible SIP population. So high users who had been in SIP hotels for at least 90 days, and then a control population that was very, very similar when we looked at all the characteristics that we matched on. And so we created our design like that, and we can go to the next slide. And so in terms of results, the 343 SIP guests who met criteria for our study comprised 13.6% of all the guests who stayed in shelter-in-place hotels for at least 90 days. The mean age was 52.2 years. They were 70.7% male, so vast majority male, 41.3% Black, and 49.1% had been homeless for over 10 years. This is not entirely atypical for us in San Francisco. We have a fairly large population of people who have been chronically homeless for very, very long periods of time. And unfortunately, like as in many jurisdictions, due to years and years of structural racism, we have a population of people experiencing homelessness that is disproportionately Black compared to their proportion in the city overall. You can go to the next slide. So these are our results. And I think if you go to the next slide, it kind of, I have highlighted the key findings. So what we found is when we looked at those people that were high service users before being placed in SIP hotels and compared them to high service users who did not receive placements, there were significant reductions in a lot of categories of their health services use. So they had significantly fewer emergency department visits, inpatient days and inpatient stays, and psychiatric emergency department visits. You can go to the next slide. And so what we concluded was that using existing hotels as non-congregate shelter with embedded health services, it can be an effective strategy to both mitigate COVID-19 risks, which was the main intention, but also to reduce acute use of health services among people experiencing homelessness who had this history of using a lot of acute health services. And then what I did next was just to give a little bit of information about the current state of SIP hotels in San Francisco. So the SIP hotel program in San Francisco has ended, and what the Department of Homelessness and Supportive Housing has been trying to do is place people in other living situations. They have different ways that they determine sort of who should go where based on sort of risks that they assess and other factors. But you can see here that so far, and they keep this pretty updated on a day-to-day basis, actually. So I think it's great that they're being transparent about what's happening to the folks that had these SIP placements. So about 62% exited to some form of housing, whether that was permanent housing, rapid rehousing, some were reunited with family and friends, et cetera. And then about 38% exited to temporary shelter, other institutions. That was a very small number of individuals. And then this other category, which includes things like, they decline services and that sort of thing. If you go to the next slide, this just looks a little bit about the demographics of the guests that exited the SIP program. And I just think it's nice that they're looking at some of this to try to provide information about how the exits are going. Apologies for my dog in the background, unavoidable. Sorry about that. So I think that's all I had. If you want to go to the next slide, and I just want to, again, thanks to BHHI and to the UCS, that's supposed to say San Francisco Department of Public Health. And there's my email if folks have questions. But if people have questions, I am happy to take them, and as is Mark.
Thank you both so much for joining and for that wonderful presentation. I do have a question while folks are gathering their thoughts. What are the implications of your research for kind of broader policy around homelessness and housing?
Yeah, it's such a good question. Well, I mean, I think one of the really interesting things is, I've done a lot of research on people experiencing homelessness and their use of the healthcare system, and I've reviewed a lot of research on the topic. And it's interesting because it's really, really hard to show that an intervention reduces acute health services use, especially of emergency departments. Like, lots of things have been tried, and it's just really, really difficult to get anybody that I don't care if you're experiencing homelessness or if you're, Kim Johnson, people just use the emergency department. It's hard to reduce that use. So I thought one of the really interesting things was that this showed that this particular intervention did decrease the use of various types of health services, because it's not a very common finding. And I think part of that is because I think, to be honest, like these SIP hotel placements, they were, I think, in comparison to a lot of the other options people have, they were pretty nice. Like, they were hotel rooms, people had their own bathrooms, they had 3 meals a day, they had on-site services. I mean, I don't know about you, but some of the shelters, like as an emergency department provider, I can tell you, like, people don't want to go to them and stay in them because they're not, they feel like their stuff gets stolen, they're not safe, they have to take off for like the majority of hours of the day and kind of find somewhere else to be anyways. So it's like, why bother going there? There are lots of, I think, really good things about shelter and not being outside. And then I think there are a lot of people that don't want to go into shelters in their current state. So I think one thing it says is that the type of housing opportunities or this is really shelter, it's not housing. So it's shelter, makes a difference in how people utilize it. And then I think these embedded services are really helpful, because otherwise I think people have to kind of piece together what they're doing. So they might be in a shelter, but there might not be on-site health services. So where are you going to go? Like, we're open 24/7 in the emergency department. We're very low barrier. So I think a lot of people, it's a very practical choice to use those sorts of services. And I also think a lot of people tend to, have the potential to decompensate either from a mental health standpoint, from a medical standpoint, if they don't have on-site care and someone that's kind of checking in on them. So those are some of the implications to me, that the type of living environment and the services you provide is really important. That said, it's not an inexpensive intervention. It's quite costly. And so I think that's one of the reasons that it was ended. Mark, I don't know if you have other thoughts, but.
Just to reiterate and summarize that, to say that, it's an extremely expensive intervention, so not easily scalable, but kind of shows a proof of concept that these non-congregate shelters may be much more effective and appealing to people who have, our main outcomes were focused on the reduction of the acute care use, but we also saw that, 50% of the people who were in the cohorts that we looked at stayed for at least 90 days and had been homeless for 10 plus years. So people who had maybe previously, so reading between the lines a bit of the findings, people who had been not interested in congregate shelter, showing that they are interested to stay for much longer periods of time.
Yeah. And I think the other thing not to mention, like shelters, just your kind of standard shelter, it's not inexpensive. I mean, I think, it can be $80 a night or something like that for someone to stay there. So when you look at what that totals up to over a month, that is rent, right? And so a lot of it is like, where are we prioritizing funding services? And, I think part of the problem is there's this thing called the wrong pocket problem, right? So like, if you save money in one sector, so if you say, okay, well, these people aren't visiting the healthcare system, that's saving the healthcare system money, so we should put that money in housing. Well, healthcare doesn't go to pay for housing. So it's not like savings in one area translate to funding in another area necessarily. But I do think that the way that we're spending money probably does not make a ton of sense.
Well said. Relatedly, there's a question from an anonymous attendee about how much money was saved versus the cost of this kind of program. Was there any analysis done, to evaluate that kind of potential cost savings versus expenses?
Yeah, no, that was a little bit beyond the scope of this particular analysis. Again, the challenging thing is when you're talking about quote unquote savings in healthcare, it doesn't necessarily influence spending on housing because they're just two completely separate sort of sectors. But to me, as a healthcare provider, I feel like we're often asked to show this like return on investment if we're going to provide people with housing, yet we're not asked to show a return on investment, for like an extremely expensive chemotherapeutic drug that maybe extends someone's life by 3 months. So why are we asked to show return on investment for people in poverty? I don't know, but we often are, right, Kim? I mean, I think you probably appreciate that. It's just, we have to just look at what the right thing is to do over the long term.
Definitely. Let's see, we have a few other questions that have come in. How are the behavioral health supports at the SIP hotels?
Mark, do you want to speak to that a little bit, or I'm happy to, but.
Sure. The question being, what is the behavioral health support?
Yeah, like what were they in the SIP hotels?
Yeah, I mean, my sense was from our study, we saw that it actually varied by hotel to an extent. The way that the program was implemented was that the city allowed community-based organizations to provide support within the hotels, and so it varied a bit. But we did have Suboxone induction, I think, available to everybody, and referrals and connections to community-based resources as part of staying in a hotel.
That's great. And it's also, really underlines the importance of having a consolidated place where people know where to go to get those services that they need, or bringing those services to people who can utilize them. Knowing where to find help is so much of the battle. And a question from Marsh. So now that the program has ended, what is going on with the SIP hotels? Are there any plans to revitalize the program in the future or provide additional funding for it?
It's a great question. I don't know the answer to that. My sense is that the city is probably trying to think about the best path forward. I think there was a recent article, it was in the New York Times or something, about just this concept that in lots of cities, especially post-COVID, there is a lot of vacant space now because people aren't returning to offices, people are moving out of cities, maybe tourism isn't what it used to be. And so I think we have to think a lot about how can we potentially use some of these spaces, if they're not going to be used for anything else and people own the buildings, right, to provide some sort of housing options for people. But I think that remains an open question. And because of the cost, my sense is that this program probably will not be continued.
That's a shame. And of course, looking for lower cost alternatives or, like you said, Maria, the necessity of programs like this in order to provide the support needed for people to exit homelessness also has its own benefits that are financial, but also outside of finances alone. And then one more quick question from Melinda. Were there pets allowed in the hotels? Because many regular shelters don't allow pets, even service dogs.
Oh gosh, that is such a good question. Do you know, Mark?
I do not know.
I don't know. My sense is that this is just a gut. My sense is that they probably were. But I don't know for sure. I think that's super important, though. We see a lot of patients that come into the emergency department experiencing homelessness that have a pet, and sometimes it can be the thing that keeps them from staying if we let them know that once they go upstairs that they're going to be admitted, if they can't care for their pet completely independently, they have to go to temporarily to the sort of city shelter. People really feel very attached to their pets as sources of support. So, there's someone's answering. Pets were allowed in Project Room Key shelters in Ventura. So maybe, yeah.
Great. And, great point too, to the importance of, a low barrier sheltering that allows people to bring with them pets who provide so much emotional support, um, especially, for everyone. Yeah. And that looks like the last of our questions. So thank you both so much for joining today. Please, of course, feel free to log on, but thank you for your presentation and all of your research. We'll look forward to hearing an update on what comes next.
Thanks for having us.
Thank you very much.
So next we are going to turn to Amy Riegel, Executive Director of the Coalition on Homelessness and Housing in Ohio, for our first field update. Amy, take it away.
Hello, and thank you for having me join today. And I'm here to give an update on some of the lame duck activities that happened in Ohio as the General Assembly came back to finish up the year. It was quite an eventful time here in the state of Ohio. And so as part of the lame duck, there were sessions, but really the bulk of the work happened within the last 24 hours. The last 24 hours, a bill was put together. It was an omnibus appropriations bill that included many different items. It was mainly done without public opinion or public input, and taken to the floor. I think the last vote actually happened in the very, very late hours of the night, early part of the morning on the last day of session. And during this time, it's that period of time where the elections have already happened. So some of the folks in the legislature knew that they were leaving. The new folks have been elected. They know that they will be coming into office in January, but it is this brief time between the elections and between the new session starting that legislators try to get a lot of work done and kind of clean up for the end of the year. But also it can be a time where they try to put a lot of crazy stuff out there to get it through as the year winds down. And so in terms of housing, there were 3 provisions during this session that occurred. One related to affordable housing. One provision related to affordable housing came and it questioned how you're able to value affordable housing and how county auditors should do the valuation. There were 3 different methodologies that had been codified previously that were allowed for the valuation of affordable housing. Supreme Court cases in the state of Ohio had struck down 2 of the methodologies, leaving only one methodology that was not favored by many of the auditors, but was really the only one still standing. The new statute basically said that all 3 are back in play and that auditors were able to choose any of the 3. And so this has a huge impact on the valuation of properties because it allows for those property taxes to be assessed based upon what market rate rents would bring in for the property and on other types of appraisals other than the actual income that the property is acquiring. So that was problematic. Another provision prohibited the twinning of both state historic tax credits and the low-income housing tax credit. Also problematic because that is a small but sometimes used tool for the development of affordable housing, and this provision would prevent that from happening moving forward. So another one that advocates were really stressing, but the one that really kind of pushed on a lot of the advocates was that they needed to do an additional appropriation for the remaining emergency rental assistance dollars that were allocated through ERA2. And so there was about $161 million left in the state of Ohio after reallocations. And so the state government had to allocate those dollars. When they appropriated the dollars to be spent in the state of Ohio, they added in a sneaky little provision that said that those dollars could only be spent on utilities or rent that were incurred prior to December 31st, 2021. So not even the year that just ended, 2022, but going all the way back to 2021. And it also put a end date on the program of December 31st, 2023. So ERA dollars have been very beneficial in the state of Ohio. Ohio is a big state. It has a very large need, sometimes definitely not as prevalent as some of the bigger states like a California or a New York or a Florida, but still by number of people living within the state and the number and the amount of assistance received, it's a substantial amount. And we are seeing our evictions rates climb back to pre-pandemic levels. We're seeing our rent increase dramatically. And so these ERA dollars are extremely important. We had already been fighting with the state legislature to continue to appropriate those dollars so we could meet spending targets. And now here we are, they've appropriated the dollars, but they've put this stipulation on that says that the expenditures can only be used for costs incurred before December of 2021. There are no applications waiting in the state of Ohio that have expenses before December of 2021. So this basically left the funding null and void. We, as advocates, came together across the state with community action agencies, with community organizations, with all different types of groups, and really pushed on the governor's office for a veto. There was a lot of support for the veto in the Senate, even in one of the senators who had an instrumental role in pushing the language during session. But alas, we were not granted a veto. The bill actually went through clean, meaning that the governor signed the bill as is, leaving housing valuation, the lack of twinning of historic tax credits and low-income housing tax credits, and this ERA provision. So we now must work with the legislature who wrote that language to begin with to try to get them to fix it early here in this this new General Assembly to try to make it possible to use those ERA dollars. We are hopeful, but even if we work at warp speed and work as diligently as possible with the legislature to get this passed, late February is probably the earliest it will be passed, more likely to be in a bill in mid to late March. So that without that, the communities across the state are running out of money. They're facing the possibility of having to lay off the staff that was administering the ERA program. And once again, it will put Ohio in great jeopardy of not being able to meet spending thresholds and different requirements that have been set forth on these dollars. So just wanted to provide an update. We still continue to advocate, to push, to tell the folks at the State House, the governor's office, and all of our communities of how important these dollars are. But as we get opportunities that come down from the federal government and having to churn them kind of through this very Republican controlled, conservatively controlled state legislature, the outcomes aren't always at the same speed or at the same frequency that we would like them to be making it much slower to get these dollars out. Not that the need is less, not that we couldn't use those dollars here in the state of Ohio, but really it's just based upon that we have to cut through a lot of red tape in order to get there. And so our advocacy staff here, Gina Will, and Marcus Roth and Ken Williamson, they've been working really hard and advocating, and I'm really proud of the work that they have done, and we're very hopeful. But what we know is it means that there's going to be a little bit of a lag, and we are very worried about what that lag is going to bring to renters in the state. So I appreciate the time and the ability to give this update. Thank you.
Thank you so much for joining, Amy. And it sounds like, you know, much like on the federal level, the good folks of Ohio have their work cut out for them in this new session. Oh, go ahead.
No, I was going to say, yeah, we send a lot of gifts to the legislature.
I believe it. I just have a question. How is Ohio working with some local advocates to really make the case to their legislators on the need for these dollars and for, you know, better policies to administer them?
Yeah, so we are working to use more data and analytics to kind of tell the story around this, but also to show the court cases and how they're increasing, to show how rent is really increasing. Ohio is known as a very affordable state to live, but that is, especially in many of the larger cities, quickly declining. They're hearing us on increasing supply of housing. There is a conversation. The governor, in not giving us any of the vetoes, did pledge to support the state housing tax credit. However, that doesn't help people be able to afford the units. And so we still have a lot of work to do in that space to really help the folks understand what that need is and who it looks like, that it's hardworking individuals that still have this need within our communities.
Definitely. Well, thank you so much for joining. Oh, question just came in. A question from Daryl Christensen. Amy, are you partnering with your Centers for Independent Living?
Yes, we work very closely with their state advocacy group and with their state coordination, including representation on their board by one of our staff. So we work very closely with them and being able to support individuals in the state.
Great. And we got a thumbs up from Daryl. Wonderful. Well, thank you so much, Amy, for joining. Please, of course, as always, feel free to stay logged on and watch the rest of the call, but really appreciate you taking the time and sharing with us some updates from Ohio.
Thank you.
And next, we are going to turn to Jenny Jones, who is Communications Director at the Minnesota Housing Partnership, for her field updates. Jenny, go right ahead.
Hi, thanks for having me. And yes, I'm with MHP. We actually do work all over the country, so we're trying to kind of get that acronym going. I was asked to talk about the process of organizing a rally we had to launch the legislative session and how it's going to set the stage for our advocacy for this year. We had a wonderful rally. Our legislative session in Minnesota kicked off on January 3rd, and so we reserved the rotunda at the Capitol for January 11th. And we themed the rally Start with Home, which had sort of a dual message of both launching the session and framing housing as a foundational need. One of the things we did was collaborated. There were 4 of us who organized the rally, and each partner really brought something different to the rally, which was great. One of the organizers, Beacon Interfaith, has a lot of congregational support, so we knew we'd get members of the public there. Habitat for Minnesota has smaller orgs all around the state, so we knew we were going to get, statewide advocacy or advocates on board. And then the Metropolitan Consortium of Community Developers has the support of businesses. So we set off with the goal of getting 100 organizations to endorse. We got close to 80, so we felt pretty pleased about that. And one of the things that the rally did was really promote unity with all these advocates at the beginning of session. So we tried to have a very dynamic lineup, started with some Native leaders, county leadership, people with lived experiences, and going to the leaders in state government. Once we got one big speaker, another wanted to join. And that sort of kept happening until we got the whole leadership lineup. So how it will set the stage for our advocacy. Getting the governor, lieutenant governor, speaker, majority leader of the House, majority leader of the Senate, getting them on record to make significant commitments to housing is really going to help us. We will be reminding them of that throughout the year in the session. The rally also helped us ensure that the three houses, the House, Senate, and governor, are aligned in prioritizing housing. Now, we just in Minnesota got a trifecta, which is great news, but it doesn't necessarily mean that all three levels of government are going to be prioritizing housing. But this sort of got everybody on the same page and helped with that alignment. Of course, the rally got organizations really amped up for the session, so that was a big plus. It led to some great press indicating a big commitment to housing, including one that made the front page and talked about a $1.7 billion a year bill for rental assistance being a top priority. Sort of the downside was that one of the things we learned is that other asks for housing besides that rental assistance weren't really paid attention to. Lawmakers wanted to focus on sound bites and solutions in their talking points, so they just focused on one issue area. But what it will do for us moving forward is give us time to educate them, keep them committed to what they say they will do, and make sure they understand the whole continuum of housing needs. Also that our particular issue, which we wanted to move forward, which is a constitutional amendment for housing, which we've just embarked upon. That really wasn't the way to introduce that. So it needs its own kind of unique kickoff. But overall, we were pretty pleased with the rally and think it's going to really help us for this year in our advocacy work.
Fantastic. Thank you so much, Jenny. We have a question from Erica Robbins. Who are the partners and organizations invited to the rally?
We invited all housing organizations, and housing adjacent organizations. So the organizers were the four that I mentioned, but we tried to get as many organizations statewide as we possibly could. So anybody who believes in housing.
Oh, we have a follow-up question from Erica asking for the 4 specific organizations who helped partner.
So that was MHP, Beacon Interfaith, Habitat for Humanity of Minnesota, and MCCD, which is the Metropolitan Consortium of Community Developers. So 4 pretty established housing organizations. And we all, have partners throughout the state, so we're able to get them on board as well.
Well, fantastic. And it looks like the rally went really well and that there was a really great turnout too. I love those pictures.
Yeah, it was good.
And a question from Jordan Stalker. What are some of the components in the proposed housing amendment?
I could give a whole speech on the constitutional amendment, and we are still kind of in the throes of putting together that policy. But if you go to MHP's website, that's going to be up soon. And like I said, I could give another speech on that, but I don't want to divert too much from what I'm supposed to speak about. But you'll hear more soon.
Awesome. We'll have to have you back for an update. And I just, for reference, dropped a link in the chat for folks who are interested in taking a gander at MHP's website. Question from Daryl Christensen. Jenny, do you partner with your CILs? There are a number throughout the state. Centers for Independent Living, I believe.
Oh, okay. You know, our policy director would know more about that. There really isn't anyone we don't partner with, so I'm guessing that we do, but I can get back to you with specifics on that.
Great. And Daryl, feel free to follow up with me or Jenny directly, and I can make sure you get the information that you need. And a question from an anonymous attendee, why did it feel like the rally wasn't the right place for the introduction of the constitutional amendment?
Well, like I mentioned, both the legislators and then the press, it's hard to know, you know, chicken and egg on that, really wanted to focus on sound bites and solutions, and they could kind of just get their head wrapped around the one big bill, which was the rental assistance bill, for whatever reason. So I think constitutional amendment is such a new idea, and we in Minnesota don't have a lot of ballot initiatives. We're very different from a state like Oregon or California. And so it's harder to just soundbite that one. So that's how I'd answer that.
That totally makes sense. I don't see any more questions. So Jenny, thank you so much for joining and for sharing your updates. And we'll look forward to hearing more about the plan as it comes along.
Thank you so much.
Thank you. So last but certainly not least, I am thrilled to introduce my colleague, Sid Betancourt, who is one of our very talented field organizers and is going to share a preview of our Tenant Talk live webinar series for this year. Sid, take it away.
Awesome. Thank you so much, Kim. And yeah, perfect. That slide is perfect. So hello, everyone. My name is Sid. Use she, they pronouns, and I'm a housing advocacy organizer with the Coalition. And I'm happy to be here today to talk more about the Coalition's monthly Tenant Talk live webinar and more ways for tenants and residents to be engaged with our network. And next slide. Thank you. So what is Tenant Talk Live for folks that haven't attended it yet or just haven't heard of it yet? Tenant Talk Live is a webinar that provides tenants and residents with the opportunity to connect with one another, but also with NLIHC. We kind of just talk about best practices and how to be more involved with federal housing policies and influencing them. And for some historical context, the webinar was created, I believe, prior to the onset of the pandemic, like right before it, but it really grew during 2020 as resident leaders wanted to learn more about how the pandemic was affecting their lives and how others were responding to those effects. So it has since grown to feature a lot of relevant topics to tenants. We've also incorporated listening sessions and fireside chats and hope to continue growing this in the future. And as you see on the screen, these webinars occur the first Monday of every month at 6 p.m. Eastern time. So the next webinar will be on February 6th. And the topic of that webinar will actually be on international housing models from groups that within our networks that have recently traveled abroad to learn more about housing models that have helped other countries address their housing crisis. So please feel free to use the link in the chat to sign up. And next slide, please. So before I kind of give a preview of the 2023 topics that we're hoping to explore, I do want to kind of just show the great work that was done in the past year. So for folks that are newer to the webinars and haven't attended, on this slide, you can kind of see like how diverse our topics were last year. Individuals got to learn about specific topics and strategies that they could bring back to their communities. And the images that you see on the slide themselves, I know they might look a bit small on the computer, but hopefully in the recording, you'll be able to see that they're talking more about like tech, like tenants' rights and organizing for housing choice vouchers, and also a Jamboard from one of our listening sessions on tenants' rights. And I always welcome feedback on topics or just feedback on the webinars themselves. So if you want to provide any ideas, you can always feel free to email me at sbetancourt@nlihc.org, and we'll drop that in the chat as well. Next slide, please. Thank you. So I also do want to briefly just give a shout out to all the organizations that we worked with last year to complete these webinars. NLIHC could not have done any of these webinars without them, and I appreciate their insight a lot. And I also want to give a huge round of applause to the tenants who joined as panelists on these calls and were willing to share their experience with the public, because it's not an easy thing to do, but through their sharing, others were able to learn from their experiences and also come together as like a community to come up with possible solutions to their concerns. And it's not perfect. Not everybody was able to find the perfect solution to their problem, but I think because of the strong community that we've built, folks have been able to kind of share more out over time without feeling bad or anything. But yeah, thanks to everybody who participated. And if you're on this slide, thanks for being here again. Next slide, please. So forecast for 2023 Tenant Talk Live webinars. So at the end of last year, I did do a survey for the attendees of the webinar. And here's some of like the ideas that were shared with us. And I did include the international models of housing justice that I mentioned earlier, because it'll be our topic for February. But some of the reoccurring topics that came out in the survey were around tenants' rights and tenants' unions. And I look forward to exploring those particular topics, but also the rest of them on this slide in the future. And if any of you in the audience today have any expertise in any of these topics, please don't hesitate to reach out. We'd love to feature you as a panelist in an upcoming Tenant Talk Live this year. We can go to the next slide. And so now I'm just gonna talk about some of the other ways that folks can get involved in our work. And the first one being NLIHC's semi-annual publication Tenant Talk, which is created by NLIHC to engage renters and residents in housing advocacy. And each issue will highlight different approaches by housing advocates and recent victories run by tenants across the United States. And we also provide updates on the work that we're doing, including important policy updates that might be relevant to tenant advocates. And our next issue will actually be coming out on February 9th, and it'll be titled Advancing Tenant Protections, Building Tenant Power to Achieve Rental Equity or Renter Equity. So we'll be talking a lot about tenant protections. And if you want a hard copy of that publication, we'll be dropping a link in the chat for you to sign up. And I'll just make a quick comment. If you signed up to receive a hard copy before, you don't need to do it again unless you need to update your information. Next slide, please. Thank you. So in the last year, NLIHC has built a tenant leader cohort, which consists of individuals with lived experience of housing insecurity who have become leading voices and advocates in their communities and their fight for housing justice. Next slide, please. Thank you. So, excuse me. Since the inception of the group, we've had a lot of successes. And a lot of it has to do with the leaders themselves. So if you're on this call, thank you so much for partnering with us to do this work. But in October of 2022, we had a retreat where tenant leaders were able to meet one another. And we were able to have like a discussion around the work that they're doing in their communities. We also got to talk about the upcoming forum for NLIHC and just kind of building out plans for our policy priorities and also the work that we do on tenant protections, like as an organization. Some of the leaders in the cohort were also featured on an episode of NLIHC's The Homefront podcast, where they discussed housing policy priorities and elevating the overall conversation around America's housing crisis and the importance of housing advocacy for the most marginalized and lowest income communities. And most recently, the tenant leader cohort also had the opportunity to join a meeting in November of 2022 at the White House with other people with lived expertise, legal aid advocates, researchers, et cetera, to discuss tenant protections and housing affordability in the United States. And so we got to meet with the cohort beforehand so that they could prep on what they wanted to talk about with White House officials and federal agency officials. And so we talked a lot about making sure that racial and disability equity was included in policy making moving forward, rebalancing the power between landlords and tenants, ensuring that tenants had representation, prioritizing deeply affordable and accessible housing through rental assistance, the Housing Trust Fund, and public housing. And then the last point that we made was, and certainly not least though, but increasing resources to make sure that low-income people have access to homeownership and that they're able to maintain that homeownership and build financial stability. So a lot of folks have been asking questions about the cohort, and it is closed for now, but please do not let that discourage you from being involved, because our goal is to also keep this going and have new cohorts in the future. So please be on the lookout for that probably later this year if you're interested in being part of a future cohort. But yeah, next slide. That's it for me right now. And if you have any questions, please feel free to email me or call me at the phone number on the slide, and I can answer questions too.
Fantastic. Thank you so much, Sid. We have a quick question from Robin. On what night is Tenant Talk Live?
It's the first Monday of every month. So the next one will be on February 6th at 6 p.m. Eastern time.
Awesome. There's a question too from Jordan. Not sure if you mentioned this, Sid, but is the newsletter available digitally?
Yes, it is. So it'll be made available digitally on February 9th. And we'll also have it in Spanish, like maybe a month or two afterwards, available digitally.
Awesome. Sid, I'm not sure if you know the question or the answer for this off the top of your head, but for tenants who are tuning in and who might be interested in getting involved in a tenant organization in their community, or a tenant union in their community, are there any resources available where they would be able to connect to those organizations?
That's a good question. There is like a link that I can, I don't have it like at my disposal right now, but I could probably look it up and we can share it with folks afterwards. That kind of has a list of organizations that are current, but I haven't looked at that in a few months, so I don't know if it's up to date. But we do have like our state partners like network, which they can reach out to and ask that question to and see if they know of any. But if not, definitely start your own. I know it's hard, but we also have resources to help you start your own as well. So
that is fantastic. And Sid, for folks interested in getting involved in, say, the tenant leader cohort, or just, getting more involved in some of the tenant work, what ways are there for tenants to get more involved in the work NLIHC is doing?
Yeah, so one way is to join as a panelist on the monthly webinars. And usually folks will reach out to me and share their stories, and that's usually how I bring them in if they're interested. So please feel free to reach out to me if you want to be involved in that. We also have the On the Home Front blog, which is not to be confused with our podcast, it's separate, but the On the Home Front blog provides an opportunity for folks to just share their story on a public forum and kind of just talk about housing justice advocacy in a public forum. And we also invite tenants and residents to write articles for the Tenant Talk newsletter. So if you're interested in writing a piece for the future, again, please feel free to reach out and we can kind of talk about what that looks like. Yeah, and there'll always be opportunities and we try to market them best when we can. So be on the lookout for that in our newsletters.
Awesome. And we'll also be sure to include those resources in our follow-up emails and summary of today's call. Well, thank you, Sid, so much for joining. I don't see any other questions coming in on the chat, but you are getting some love in the chat for all of the excellent work that you have been coordinating with our tenant leaders. So thank you so much for joining. And we'll have you back to talk more about the awesome work with tenants that we're doing.
Thank you.
And that wraps us up. That takes us to the end of our call. Thank you all so much for joining today. We will be back in 2 weeks with another House Campaign National call. And in the meantime, subscribe to our newsletters, get involved, check out our Take Action page. Feel free to email us with questions. And thank you all so much for coming. And thank you all for all of the excellent work that you do. Until next time.